The pain was just steady. Like every day I woke up, I felt like I was out of breath. It told me that I was gonna need a heart transplant. For somebody to be going through what I was going through at 25, was kind of a big deal. I wouldn't know if I was gonna make it or not.
I was shaving one morning and discovered a lump on my neck. There was not only a tumor in my neck, but there was also one at the base of my tongue.
Because before this all happened, I was running about 3 miles a day every morning before work. After 2.5 years of chemotherapy and the same treatments, I had pretty much run out of options, I felt. I knew I needed to go somewhere else that would be on the leading edge and would actually offer some other types of treatments that might actually work.
The University of Chicago has never been satisfied with standing still. It's always thinking towards the future.
This is medical care delivered in an environment of the profound exchange of ideas and the highest level of research and inquiry. We have 3 fundamental missions: research, education, and patient care. It's essential that we do every one of these at the very highest level, and the new hospital is going to be the venue where this takes place.
Where we are now is that we have outstanding programs with physicians that are leaders, national and internationally, and we need capacity to innovate where technologies are concerned, where access to new treatments is concerned.
To be cared for with the latest medical innovations, the latest and best technologies in a beautiful building designed by a great architect fills people with confidence and trust.
The new hospital is strategically situated between 2 of our major research buildings. It's going to be a very efficient and synergistic way to think about integrating patient care, research, and education in the future.
We're all on the same campus. So in the morning, I'm in the clinic, and in the afternoon, I'm coming back to my laboratory and talking to other scientists in the lab to help me figure out how I can help a patient who had just come to ask me about what to do about her cancer risk.
After about 15 months, I believe, I had another tumor. So this was tumor number 4. And so at this time, it was like, what do I do now? Dr. Nicholas said, we need to try something different here. You've been on maintenance chemo. We need something more aggressive. He goes, we're doing a study on this right now, and I think that would be the best option for you. Scorpion venom goes right to the tumor, and it leaves all the other healthy cells alone. And the radiation just hits the tumor, and those 2 combined will just knock it out.
We've always emphasized that you have to deliver the latest and the best care in a humane environment that focuses on the patient and regards the patient as the center of the equation.
Technology has really given us the leapfrog effect for therapeutics, diagnostics, and really patient-centered care enhancement. And I think that's the key here, is to understand how technology can be leveraged to make a better patient-centered environment and a treatment center for all those involved, including the family.
One of the things that we find so exciting about the new hospital environment is its adaptability. It's designed in a modular way so that it can accommodate new technologies that haven't been invented yet, and that our physicians and scientists are helping to invent. We have minimally invasive approaches that we're pioneering, instruments that are smaller, that are smarter, that are able to be used in novel ways to treat even the most complex disease. The new hospital allows us to integrate these new technologies to do advanced surgery for very difficult, complex problems, still in a minimally invasive way.
I went to the website at the University of Chicago, found Dr. Vokes on the directory, clicked his email address, and sent him a quick email. I was surprised that the next day I heard back from him. He made arrangements for me to come in the following day. There were a team of people waiting to inspect me. Dr. Vokes was a pioneer of a certain type of treatment that had been quite successful here at the University of Chicago. I did not have to have any further surgical procedures done in terms of removing any sections of my tongue or jaw.
The new hospital is designed specifically with what an academic medical center needs. So a student who's learning about heart anatomy, who is seeing advanced MRI scans reconstructed in 3 dimensions in real time, and they're also getting a simultaneous feed from the operating room where a advanced valve replacement surgery is being performed or a heart transplant is being done. That's a very powerful way to transform surgical education, the training of medical students.
My doctor put me on the top transplant list. 3 days later, he had a heart for me. 2 years ago, I was dying. I received a heart transplant, and 2 years later, I became a firefighter. The rest of my life, I get to save other people's lives. You know, that's like, you know, what better job than that can you get?
As patients have complex, multi-system illnesses, you have to be able to work hand in glove with your colleagues. All of us work in the same institution, and now we're all going to be at the new hospital. And so you've got internists and surgeons and specialists working side by side.
Interdisciplinary approaches to all things are a norm here as opposed to an abnormality. That ability to intermesh specialties, to combine disciplines, and really forge perhaps a new discipline is what I think will come out of the new hospital.
I get so excited about the prospects of now having a transformational space where we'll be able to really create the future of medicine and surgery.
It fills me with enthusiasm to want to walk through that hospital and work in it, care for patients in it. It's going to be great.
At the end of the day, I felt like there were a lot of specialists who were very focused on me. This past October was my 2-year anniversary date. That's what they focus on. I'm very fortunate. I'm in remission.
I went back to be a 2nd grade teacher this year, and I really enjoy it. I think University of Chicago is one of those types of hospitals that are willing to do clinical trials and are willing to kind of go beyond just the standard care.
This is the best hospital in the world. The things that they do for the people here and the way they make you feel is just like no other. I've been to other hospitals, never felt that way. I'm glad I came here.